Welcome to home video assignment number 5. You'll be performing an interrupted subcuticular suture and a running subcuticular suture. First, we should review some fundamental principles of correct suturing technique. Two common rules are to always enter the tissue at a 90-degree angle and to rotate the wrist to follow the curve of the needle. However, it's not enough just to focus on these 2 points. They are actually end results of these 3 elements. First, the needle should be loaded correctly and adjusted as necessary. Second, the tissue should be manipulated to provide the best angle for needle entry. And lastly, the body should be oriented for optimal ergonomics during the task. The following clip will illustrate how adjusting the needle angle can facilitate a running subcuticular suture. When sewing the far edge of the skin, it is helpful to load the needle at an angle. It keeps your hand from pressing into the patient. If you load the needle neutrally at a 90 degrees, then your hand will push into the patient and you'll have to compensate by pulling up on the tissue. For the near edge of the wound, it is preferable to load the needle at a 90-degree angle. This places the hand and the wrist above the patient and the elbow at the side of the body in a neutral, comfortable position. With the needle at an angle, the elbow is forced high up in the air in an awkward position. The following clip will show you how minor adjustments in your body position can affect your suturing. A simple running suture is being placed. As you can see, the surgeon is facing the incision directly, and notice how the elbow and the forearm is away from the body. This is an acceptable position. However, by turning the body, you bring in the arm and the elbow closer into a more comfortable position. This type of attention should be paid to your ergonomics during any task that you perform. The next 2 video clips will demonstrate the most egregious mistakes of body positioning. In these cases, the surgeon is sewing away from himself. As you can see, because of the improper orientation, the surgeon's elbow digs into his body with each stitch. The wrist is also at an awkward angle to try to compensate. Sewing in the wrong direction for a running subcuticular suture results in a high elbow that is unstable and awkward. Trying to perform this task in this position will be much more difficult and uncomfortable and likely result in a poor outcome. When sewing, try to be aware of your body and whether you are comfortable or not. An easy way to remember this is notice where your elbows are and how your wrists look. If your elbows are high up in the air or your wrist is unnaturally cocked, that means you need to make adjustments to try to improve your positioning, either by changing the angle of the needle, manipulating the tissue, or rotating your body. Interrupted subcuticular suture, 4 knots, 45-second time limit. This task simulates the closure of laparoscopic port sites that are commonly done with a single subcuticular or a deep dermal suture. Notice the extra attention paid to the location of the tail end of the suture. It is placed towards the surgeon. And now also note that the tissue is grabbed close to but not at where the needle is driven into the tissue. Both ends of the suture are then pulled towards the surgeon to bring the edges of the wound together, and then 4 hand-tied slip knots secures the stitch. Running subcuticular suture, 3.5-minute time limit. The apparatus you'll be using will be a foam pad with a 5 cm incision and 1 centimeter hash marks. Start by placing a deep anchoring stitch and secure it with 4 instrument ties. Then bring the suture out through the corner, and you can start your running subcuticular suture. As explained in the previous video clip, you do not want to start the subcuticular suture left to right. You want to start it from right to left. This orientation will prevent you from suturing away from yourself. Be sure to grab the foam just beyond the hash mark to provide tension and exposure during this task. This point emphasizes the fact that you should not grab the tissue at where you're trying to either drive the needle or where you anticipate the needle to exit the tissue. You should travel 1 centimeter with each bite of the suture. You should also be sure to change the angle of the needle for the far side and the near side edge of the wound for optimal ergonomics during this procedure. As described previously, the needle should be loaded at a 90 degrees when sewing on the near edge of the wound and angled when sewing on the far edge of the wound. When you have reached the end of the incision, place an additional stitch on the opposite edge and then secure the suture using an Aberdeen half hitch knot. To form an Aberdeen half hitch, leave the last loop of suture loose and place your 3 middle fingers through the loop. Hold the other end of the suture with the needle firmly, and then hook the end of the suture with your middle finger through the loop and tighten by pulling on the long end of the suture, which is usually the bottom strand of the loop. 3 knots are thrown in this fashion, and in the final 4th knot, the needle is released and pulled through the loop completely. A final stitch is then placed to bury the knot.